been planning since a while.
Yes, yes, yes. That's why, like, a lot of preparation and planning
Yeah,
and
yeah,
scheduling goes because we want to bring like the best kind of topics that will help our
certainly.
community moms. So, Dr. Kansha is a pediatrician. She runs a page called Bustle Boon on Instagram. That is where you can reach out to her. She's based in Delhi, and I think Dr. Kansha will add a little bit to her introduction.
So I've actually recently completed, like it's just been 2 years since I've completed my MD in pediatrics, and I've done all my training from Delhi. And apart from that, I am also in process of getting a membership of the Royal College from London. So it's been a long journey for me, but I think I'm getting there. And yes, definitely anybody can reach out to me on my page.
That's so exciting. So we're so happy to be a part of your journey. All the best for your
Thank you.
applications. So
Thank you.
let's quickly dive into the topic, and that is tomato flu. Like,
Yeah.
I think every mom's nightmare is waking up and finding out there is a new flu variant, and, like, what does it entail? So let's just get started with the latest flu variant, and that is tomato flu.
So let me just break the myth here that tomato flu is not something which is new to us. It's been there for years now, and it is something which has always been there in the West. It usually occurs a lot in the spring summer season, and it's known to cause epidemics in the West. But I think why it was a little dormant in India all this while is because of a certain hygiene hypothesis that we have, because in India we have a lot of other flu variants that kind of get us that kind of get us immune to a certain variants of flu. So tomato flu was one of the flu variants we were immune to. It's known as the hand, foot, and mouth disease in scientific terminology, and it's basically nothing but just a set of viruses that we are not immune to anymore because of staying indoors throughout the period of the pandemic. So there's nothing really new about it. There's nothing to be really scared about it. It's always been there, and it's always been coming and going. So I think that is an important myth that everybody needs to clear out.
Right. So, Dr. Kansha, so this virus, tomato flu, mostly affects only kids, or does it affect adults as well?
So tomato flu is actually caused by a set of viruses. It's like around four major genera of viruses that cause this hand, foot, and mouth disease, and it can occur in both adults and children. Although the presentation varies when it comes to age groups, and it's known to be somewhat like chickenpox. You know how we say that chickenpox causes a more exaggerated presentation in children when compared to adults. Like if any of our viewers have had chickenpox as an adult, they know that it's not really that bad when it's compared to somebody who's had it in their childhood. So it's the same for hand, foot, and mouth disease. And in fact, in most cases, adults usually have somewhat a better immunity to it, and they don't really present most of the times, although they can be carriers of the virus. So for an adult, if you look at it, hand, foot, and mouth disease can just be presenting as any other, cold. Like it can present with a fever, with a sore throat, and that is all they'll have. But then they'll be carriers, and they might transmit it to somebody of a younger age group, like suppose a child in the house, who will then present to us as a fledged hand, foot, and mouth disease with all those eruptions in the hands, in the feet, and in the mouth.
So, is it any different? Like, is tomato flu any different than HFMD?
No, they both are the same. It's just the name that varies. In scientific terminology, we call it the hand, foot, and mouth disease, and it's called tomato flu in common parlance because of the presentation, which is the rash that is a reddish rash that kind of looks like tomatoish in color. So that's why it's
Okay.
called the tomato flu.
Okay. And so, what precautions do we take,
Yeah,
like, now that our kids have finally started going out to school again, and we would not have the heart to again put
yeah,
confine
definitely.
them to indoors. So what kind of precautions can we as parents take, or we can suggest that our school, like a play
Yeah.
school, can take?
Yeah. So I think it's important to recognize cases, because until we do that, we'll not be able to isolate them and stop the transmission of the virus. Because in hand, foot, and mouth disease or tomato flu, what happens is that during the first week of the illness, whoever has the disease, it's the most transmissible during the first 7 to 10 days. So it's important for us to recognize that and isolate that child, so that he doesn't become the source of infection for other children who are in his company, his or her company. So it's very important for us to understand how tomato flu looks like. If you go online, you'll find the exact picture of the rash. But to describe it, if you ask me, I'd say that it can present as a reddish kind of an eruption. It can even be a vesicle. A vesicle is something which is, a rash which is filled with fluid. So,
Okay.
the kind of rash that we get in chicken pox, it can even present as vesicles, but reddish eruption is the most common presentation. So you should kind of have that idea about how a rash of the hand, foot, and mouth disease looks like. Another characteristic is, as the name suggests, a rash of the hand, foot, and mouth disease usually presents on the hands, in the feet, and inside the mouth. It doesn't really present on the trunk of the child, like anywhere on the front side or on the back side. It doesn't really present anywhere there. It will only present on the extremities or inside the mouth.
Okay.
So I think this is something we need to convey to the play school teachers or whoever is there in the child's schools as well. And I'm sure that teachers are becoming more aware nowadays. So they should also be aware of this. And if at all they see something like this in their classroom, then they should make sure that the parents are conveyed and the child is isolated for a period of at least a week inside his house.
Okay, a week. A week
Yeah,
is necessary for the child to
yeah,
be
yeah,
isolated.
yeah.
So, are these rashes that we're talking about? Are these itchy in nature? Like, do kids,
They
tend?
definitely can be itchy. That again is variable. It's not mandatory they will be itchy, but they can be itchy. And trust me, the management of this, condition is very, very conservative. Like we are not expecting any complications. We are not expecting a rash that will stay for life or leave marks. It's very, very, it's very, very reversible. It doesn't leave any marks on the skin. Even if the child is itching, it won't leave any marks on the skin. Like we say that, if a child smudges a chickenpox rash, it has a tendency to leave a mark. So that does not apply to hand, foot, and mouth disease. But what we usually do for curing the itching is just apply some lactocalamine lotion. I'm sure all of us have used it on ourselves as well. So
Right.
that is the only thing we have to use to take care of the itching, and we can use it as much as possible. It's not restricted at all in such scenarios when there is a rash on the skin.
And if the rash is also developed inside the mouth, like what precautions can we take then?
So basically, rashes in the mouth, they are not usually painful when it comes to hand, foot, and mouth disease. But again, if they are on the hard palate or, if they are in that soft palate area where the child is swallowing from, that can be a little painful sometimes. So one solution for that could be just primarily shifting to liquid diet for the first 2 or 3 days. Or, semi-solid or liquid diet is one solution. Try to give the child more of ice cream, more of, ठंडी चीजें देने की कोशिश करनी चाहिए, because that provides some relief to the nerve endings there. Apart from that, if it's getting very troublesome and it's not, it's still painful, very, very painful for beyond 3 days, then there's something called as Zyte gel. So you can use that. You can get it from a nearby pharmacy, and you can use that. It will definitely work for pain relief. But I think the majority of it has to do with switching to liquid and semi-solid for the first 4 5 days. That solves the purpose.
And what are the first symptoms of this flu?
The first symptoms have to be fever and sore throat. It will look like common cold when it starts.
Okay, so we need to go to a doctor to get it diagnosed, and
Yes.
okay, like it is compulsory for moms to go
Yeah,
to a.
it's basically a clinical diagnosis. So even a doctor will just give you a diagnosis of common cold until the rash is there. Once, as soon as you see any rash on the body, I think it's important to consult the doctor, because it can be a normal viral exanthem, which is also very common in children, or it could be HFMD, tomato flu. So it's important, when you see a rash, just go to your doctor, and they will be able to make a diagnosis.
And how does this disease spread?
It spreads, that is why we isolate as well. It spreads predominantly by contact. It can spread through respiratory secretions also. Like I mentioned, in the first few days, it will just present like any common cold. So then there won't be any rash, but it can spread through respiratory droplet infection. Once the rash is there, the rash in itself is infective, so it can spread through contact, and that is why it's important for us to limit the transmission, to isolate on time.
Okay. And is there anything else that, like, parents need to know
Yeah.
about this flu? Like, what would you
There
like
are
to?
two things I think that's important for us to understand in this condition. Although it is a very, very doable thing, it's nothing to be worried about. That's the myth that I've broken already. It's as much as the news is saying it, there's nothing that is very, very exceptional about this disease, and there's definitely nothing to worry about it. But we need to be sure that we are cautious about any danger signs or anything that might need admission in a child. So, what all are some signs that can, cause a child to get admitted because of tomato flu? One is, if, like we mentioned earlier, that there can be oral ulcers which will make it difficult for the child to eat in times when they are very, very painful. So, if you see that your child is not able to take even liquid or semi solid diet, and it's getting very troublesome for him or her to swallow anything at all, then that is a case scenario where you have to visit your pediatrician and make sure that the child doesn't need admission, because it's important for us to ascertain that he is having a certain amount of oral intake. Otherwise, we'll have to start him on IV fluids, that is intravenous fluids, for the child to maintain dextrose levels and blood pressure. So you must ensure that the child is taking at least something, and it's not like he's not even able to swallow any fluid. If that scenario occurs, you must visit your pediatrician, and in most cases, this scenario will require admission. Another thing can be that in some cases, like any other flu, tomato flu can also lead to changes in the heartbeat of a child. So, if you see something, I think it's in any flu, it's important for us to keep monitoring the heart rate. Now that we all are aware about the pulse oximeters, we have most of us have pulse oximeters at home after COVID. So, it's
Yes.
very easy for us to actually monitor heart rates. Even our app watches have it now. So, it's very important, and it becomes very easy for us now. So, I think in any infection, in any flu, for children, it'll be great if the parents they monitor the heart rate and the SpO2 every 6 hourly, so that if at all it's leading to something that needs admission, they'll catch it early, and again they'll visit the doctor. So now, what are some of the cutoff points? If you ask me, then basically this varies. You have to have a certain, like, if you start early, like if you start monitoring heart rate early, you'll kind of get the normal heart rate of the child which is persisting. If you see any changes in that, like suppose the child is not having fever, and the normal heart rate for your child was 90 to anywhere between 90 to 110, and then at the next value it has gone below 90 or over 110, then that can be a little cause of concern. So just make sure that there is no change in the trend. And
Right.
another thing you have to make sure is that if at all there is a change in trend, you take at least two such points where there was a change in trend. Like there could be a change in trend once, but if there's a change in trend more than once, then that's something that you have to consult your pediatrician about. Another thing, just make sure whenever you're monitoring heart rate, the child is not febrile, because in fever, the heart rate is bound to rise.
Right.
So just take care of that. Apart
We
from
have.
that, I think in most cases, it's like I said, it's very doable. It is managed at home. But the most common problem that we see in children with hand, foot, and mouth disease is oral acceptance. So if you just take care of that, and if you just stay cautious about that, I think that's all you have to note for.
Everything else will be taken care of.
Yeah,
So, we have a few questions. I will read
yeah,
it out for you.
yeah.
इस मौसम में किड्स बहुत बीमार रहते हैं, उसके लिए हमें क्या करना चाहिए?
तो बेसिकली देर आर ऐसे कुछ मौसम होते हैं जिसमें चिल्ड्रन दे आर मोर प्रोन टू हैव डिजीजेस. This is one of those weathers, because whenever there is a change in weather, like whenever there is a spring to summer transition, or a summer to autumn transition, इसमें the diseases of children, they are bound to get exacerbated. I think ऐसा कुछ particular नहीं है जो हम suggest करेंगे कि it works for every child. बट आपको बस ध्यान रखना है कि अगर छोटा सा भी आपको कुछ लग रहा है दैट इट्स नॉट नॉर्मल, फीवर तो बच्चों को होता है इस मौसम में, इट्स वेरी कॉमन, वायरल इज वेरी कॉमन, बट एनी फीवर दैट एक्सटेंड्स बियॉन्ड 3 days नीड्स टू गेट चेक्ड. तो अगर बच्चे को बुखार चल रहा है 3 दिन तक, उसके बाद भी नहीं उतर रहा है, तो यू शुड डेफिनेटली कंसल्ट अ डॉक्टर. ध्यान रखने वाली चीज बस इतनी है कि आपको साइंस जल्दी पकड़ने हैं, लाइक यू हैव टू बी अ लिटिल क्विक इन कैचिंग द प्रॉब्लम सो दैट इट गेट्स ट्रीटेड अर्ली. बाकी बच्चों की इम्यूनिटी थोड़ी सी लो होती है अडल्ट से, सो दैट इज व्हाई ड्यूरिंग चेंज ऑफ सीजन दे आर मोर प्रोन टू गेट इन्फेक्टेड विद इवन द नॉर्मल वायरसेस दैट अडल्ट्स डोंट गेट इन्फेक्टेड विद. तो यही एक चीज ध्यान रखनी है कि कब आपको एक्शन लेना है उसके ऊपर. 3 दिन तक आपने देखा कि बुखार चल रहा है, तो डेफिनेटली गो टू योर डॉक्टर. अगेन एक साइन हम और बोलते हैं, आई टोल्ड यू अबाउट हार्ट रेट. एक साइन हम बोलते हैं यूरिन आउटपुट. तो आपको देखते रहना है कि आपका बच्चा नॉर्मली यूरिन करता रहे. अगर आपको एक भी बार ऐसा लग रहा है कि बच्चे ने यूरिन नहीं किया है, मतलब या फिर कम किया है जितना वो यूजुअली करता है, दैट इज अनदर कॉमन, दैट इज समथिंग कॉमन टू एवरीथिंग, मतलब कोई भी उसको प्रॉब्लम है, फीवर है, लूज मोशन है, उसमें यूरिन आउटपुट इज वन मार्कर दैट विल हेल्प यू रियलाइज दैट द चाइल्ड इज गेटिंग सिकर. तो अगर आपको ऐसा लग रहा है कि यूरिन नहीं कर रहा है उतना जितना करता है, बुखार 3 दिन से ऊपर चल रहा है, कुछ खाना पीना नहीं खा पा रहा है, ऐसा कुछ भी साइन लगता है, तो जस्ट गो टू योर पीडियाट्रिशियन.
Okay, thank you so much. And there's another question. How are the symptoms of this flu different from other flus?
It actually starts like any other flu. The only difference is the eruptions which occur in the hand, foot, and mouth of the child. जब ये शुरू होगा, you will feel like it's any other common cold, but then gradually you will start seeing eruptions are appearing. That is why I told priorly कि अगर कुछ भी exanthem या कुछ भी rash आपको दिख रहा है, तो it's better to go to the doctor and get it checked.
All right. I think you've answered all our questions, Dr.
Yeah.
Kansha, related to tomato flu. And I would like to say a big thank you to you from the Baby Chakra community and the community of our bombs. You've tremendously helped us and put us at peace. It is not like a new virus,
Yeah.
not
Yeah.
a new flu, but it has been around, but it was just dormant. And now, because we were in fertile environment for last 2 years because of COVID, and
Yes,
that's why
exactly.
it's
Yeah.
acting up again.
Yeah.
Right.
So here I would like to say something more because now we have some time. Since there was a question also कि हम क्या कर सकते हैं कि बच्चों को infection ना हो.
Right.
तो इसमें I'd like to tell something. मैंने पहले भी बोला है that we were in the stay home period for a span of 2 years, and now this year suddenly they've all started going to school. तो थोड़ा इम्यूनिटी डेवलप होने में दिल से टेक सम टाइम, इनको एटलीस्ट ये साल तो लगेगा वापस टू गेट बैक दैट इम्यूनिटी दे हैड बिफोर कोविड हैपेंड. So just give them some time, and another thing that can help build their immunity is giving them the right food is very important. I have seen a lot of parents who come to me and say कि बच्चा कुछ नहीं खाता है जो उस घर पे बनता है, and then when I probe into the history they tell me that they're giving him all sorts of chips, biscuits, and all processed food. So what processed food does is that it dampens the appetite of the child to normal food that we cook at home, because processed food has a lot of salt in it. So what it does is कि उसका टेस्ट डेवलप हो गया एक बार अगर उतने सॉल्ट के लिए, तो उसको घर का खाना अच्छा नहीं लगेगा. और वी ऑल नो दैट इम्यूनिटी बिल्डिंग के लिए इट्स वेरी इंपॉर्टेंट फॉर अ चाइल्ड टू हैव द राइट अमाउंट ऑफ वेजिटेबल्स एंड फ्रूट्स इन हिज डाइट.
Right.
वो नहीं खाएगा तो इम्यूनिटी बिल्ड नहीं होगी, चाहे हम उसको कितने भी विटामिन मिनरल्स ऊपर से दे दें. लाइक यू कैन बट पेरेंट्स कम टू मी एंड दे आस्क मी इसकी इम्यूनिटी बढ़ाने के लिए हम क्या विटामिन मिनरल्स दें. I can write any vitamins and any number of vitamins and minerals for the child, but if the child is not having the right kind of food, तो फिर उसकी immunity build नहीं होगी, क्योंकि we have to understand that a child is not like any other adult. The body function of a child is very different from that of an adult.
Right. So the right kind of food is very
Yes,
important,
yes,
and
yes, very important.
जितना हो सके उतना अपने बच्चों को packaged food, processed food से
Yeah.
दूर रखना. Right.
And another method of prevention of especially tomato flu has to do with hygiene. मतलब थोड़ा difficult होता है when it comes to children. Like if you look at toddlers, then they're already playing with certain amount of toys, and you can't clean them every time. But in this weather, if you try to maintain that hygiene, तो जितना maintain कर पाओगे hygiene घर में, और when they're going to the play schools, as much as you can maintain, especially during this weather, that will help prevent any viral infection.
Right.
Hand washing again, hand washing is one of the best ways to do it. Just teach your child to wash his or her hands every time he comes back home from play school, or after every time he's playing with a group of friends.
Right, right. Hand washing is very important.
Yeah.
And like COVID has also taught us, hand
Yes.
washing is
Yes.
super
Exactly.
important. And keeping the areas clean wherever kids are
Yeah.
playing
Yeah.
mostly, and try to clean their toys and the toys room often.
Yes. Yes.
Right.
Yes.
All right. Thank you. Thank you so much, Dr. Akansha. It was lovely having you over with the Baby Chakra community.
Thank you so much for having me, and I really enjoyed this talk. Thank you.
Same here. Thanks.
Okay.